Good morning, everybody. In the last lecture, I discussed about the motor cortex, and today we will be I'll be talking about the motor pathways or the descending pathways. The motor pathways, the command from the motor tract or the whatever action or initiation and the direction of the movement, it is taken from the motor cortex up to the spinal cord is via motor tracts or the descending pathways. The motor tracts primarily we classify as pyramidal pathway or the pyramidal pathway and extrapyramidal pathway. This is one way of classification, and another way of classifying the motor tracts, it is the medial group of pathways and the lateral group of pathways. Let us talk about and we can see the distribution. The lateral group of pathways, first let us talk about the pyramidal pathways. The pyramidal tracts, they originate from the fourth layer of the motor cortex, and these fibers, the fibers of the pyramidal tract, mainly the contribution, 30% contribution comes from the motor cortex, 30% contribution comes from the premotor cortex, and 40% contribution comes through the association areas. And that total makes the pyramidal tracts. Out of these, there are some bed cells are present in the fifth layer of the cortex, and these bed cells, there are about 30,000 bed cells are present, and these bed cells, they contribute the 3% part of the motor tracts. These tracts, they are known as pyramidal tracts because they pass through the medullary pyramids. As they pass through the medullary pyramids, these corticospinal tracts, they are named as pyramidal tracts. Now, these the 3% of the corticospinal fibers, they are the fastest conducting fibers, and they are fastest conducting fibers. These the fibers which are arising from the bed cells. The other fibers which are arising from premotor cortex, the rest of the fibers, that is 97% of the fibers, they are a little bit slower conducting fibers as compared to the fibers which are arising from the bed cells. And the neurotransmitter predominantly of the corticospinal tracts, it is the glutamate. Glutamate is the neurotransmitter of the pyramidal tracts. These, if we classify them as, and the extrapyramidal fibers are the ones which do not pass through the medullary pyramids. These fibers, the extrapyramidal tracts there are four, and the other way of classification is lateral group of tracts and the medial group of tracts. The lateral group of tracts are the ones, that is the lateral corticospinal tract and the rubrospinal tract. They constitute the lateral group of tracts, whereas the medial group of tracts, they are constituted by the anterior corticospinal tract, tectospinal tract, vestibular spinal tract, and the reticulospinal tract. This corticospinal or the pyramidal pathway, it has direct connection from the cortex for the control of fine movements in the face and the distal extremities. And the buttoning of jacket. That is, this is primarily, this function is performed by the lateral corticospinal tract. This is, here we can see the lateral corticospinal tracts. The fibers of the pyramidal tract, after arising from the motor cortex, they pass through the posterior limb of the internal capsule, and in the pyramids of medullary pyramids, about 80% of the fibers, they decussate. That is, they cross over to the opposite side and then they move downward. And the rest of the 20% of the fibers, they remain ipsilaterally, that is, they do not cross over to the opposite side and they run on the same side. The lateral corticospinal tract and the fibers, 80% of the fibers which cross over to the contralateral side, they constitute the lateral corticospinal tract. These lateral corticospinal tract, they pass through the lateral funiculus of the spinal cord, and these fibers, they synapse with the alpha motor neuron. Some of the fibers of these lateral corticospinal tract, maximum fibers, they synapse with the alpha motor neuron directly, and some of the fibers of the lateral corticospinal tract, they synapse via interneuron. Whereas the fibers of anterior corticospinal tract, as I had told you, they do not pass through the medullary pyramids and they run ipsilaterally and in the medial funiculus of the spinal cord. At this level of spinal cord where they are supplying, at that section, they cross over the synapse with the interneuron and then they supply to the muscles of, and that interneuron, it synapse with the alpha motor neuron of the opposite side in the medial funiculus. And some of the fibers of this alpha motor neuron, it synapse with the alpha motor neuron of the same side also. But maximum fibers of anterior corticospinal tract, they synapse with the alpha motor neuron in the medial funiculus of the opposite side via interneuron. Then, the other pathway, that is now we come to the cortex is connected with various areas. There are various fibers which arise from this motor cortex, and they are connected with the various nuclei of brainstem, and then there are some fibers and the nuclei of the cranial nerves. The fibers which are connected to the cranial nerve nuclei, they constitute the corticobulbar tracts. They are known as the corticobulbar tracts. So the descending pathways are if we talk about the corticospinal pathways, they are corticospinal pathway and corticobulbar pathways. The corticobulbar pathways, they are connected to the cranial nerve nuclei, whereas the corticospinal pathways, they connect the cortex with the spinal cord. The motor cortex, it sends some of the fibers arise from the motor cortex and they get distributed to the various structures of the brainstem and brainstem like midbrain pons and the medulla. And some of the fibers, they also connect to the tracts, they connect to the basal ganglia and the cerebellum. For controlling the posture and the balance of the body. The extrapyramidal tracts, that is the tract which do not pass through the medullary pyramid, they are the ones. There are rubrospinal tract. This is a part of lateral group of tracts. The rubrospinal pathway, it arises from the red nucleus in the midbrain, and immediately the fibers arising, they cross over to the opposite side, and these rubrospinal pathway fibers, they work along with the lateral corticospinal pathway and control the finer movements of our hand, which is required for writing, painting, and playing any musical instrument. So these muscles of your hand, the movements of your muscle of the hands, they are controlled by lateral corticospinal tract and rubrospinal pathway. Then the other tracts, the other extrapyramidal tracts, they are the tectospinal pathway, then vestibulospinal pathway, and reticulospinal pathway. This tectospinal pathway, it arises from the superior colliculus. This is the fibers of this tract. They are sensitive. The fibers, this is the tectospinal pathway. It is the shortest motor pathway. The fibers, they are arising from the superior colliculus and they are terminating in the cervical region of the spinal cord. And these fibers, they run in the medial funiculus and via interneuron, they synapse with the alpha motor neuron in the medial funiculus. These tectospinal pathway, the main function of the tectospinal pathway is to control the contralateral head movement with respect to the visual stimuli. Whenever any visual the reaction to the visual stimuli and the movement of the head is controlled to the contralateral side, is controlled by it is controlled by the tectospinal pathway. This tectospinal pathway, it is the smallest pathway running between the midbrain, the superior colliculus and up to the cervical vertebrae of the spinal cord, up to the cervical region. And these pathways, they are mainly sensitive to the visual stimuli, and they are visual stimuli, they are the input in the superior colliculus of the visual stimuli, and they take up accordingly, and they are responsible for controlling the movement of the head to the contralateral side. The other pathways, other extrapyramidal pathways are the vestibulospinal pathway and reticulospinal pathway. The vestibulospinal pathways, they arise from the various vestibular nuclei, that is, all the four vestibular nuclei, medial, lateral, superior and inferior. These vestibulospinal pathways, they are mainly controlling the movement of the head or balancing the body and head during linear acceleration and angular acceleration. These vestibular nuclei, they receive inputs from the semicircular canals and otolith organ. Once these stimuli they are received, the vestibular nuclei, mainly of the lateral vestibulospinal tract, they control the head and the body posture during angular as well as the linear acceleration. Whereas the medial vestibulospinal pathway, it controls the body and the head movement during the angular acceleration. The reticulospinal pathways, they arise from the reticular formation. The pathway which is arising from the pontine nuclei, that is known as the pontine reticular spinal pathway. This pontine reticulospinal pathway, it's an excitatory pathway. Whereas the fibers which are arising from the medullary area of the reticular formation, and that is from the spino-reticular nucleus of spino-reticulus, these fibers, they constitute the medullary reticulospinal pathways, and the medullary reticular spinal pathways, they are predominantly inhibitors. They are the inhibitors. Now, how does this reticulospinal tract and the vestibulospinal tract, they function? The reticular spinal tract, they receive a command is generated in the, it is conveyed via corticospinal tract, and it is, the limb movement will be there, and posterior, if it is coming, this command is coming only through the corticospinal tract, the posture will be unstable. So, the command which is conveying via corticospinal tract, it is also conveyed. The same command is conveyed to the reticulospinal tracts. That is known as feed-forward programmed anticipatory command to prevent instability. That is, the reticulospinal tract, it receives the pre-programmed anticipatory command. That is, whatever command, whatever action has to be performed by the alpha motor neuron, it is from the motor cortex via corticospinal tract. A copy of that, it is conveyed to the reticulospinal tract, and that is known as feed-forward pre-programmed anticipatory command. And what is the advantage of that? It helps in preventing the instability of the body posture. Now, this primarily the vestibulospinal tract, they get feedback control responses there. They act as a feedback controller of the postural instability. The vestibulospinal tracts, whenever there is postural instability, that is, they are receiving the inputs via semicircular canal and the otolith organs, and then they help in adjusting the postural, help in the adjusting the posture and correcting the instability. So this is the corticospinal tract for mainly the anterior corticospinal tract. Anterior as well, both anterior as well as the lateral corticospinal tract, they work in conjunction with reticulospinal tract and vestibulospinal tract to control the posture, to make the postural adjustments. This reticulospinal tract, it receives the information which is received by the reticulospinal tract, it is known the feed-forward pre-programmed anticipatory commands. Whereas the vestibulospinal tract, they receive the feedback control in response to instability. And then these tracts, they rectify the posture and and make the body posture more balanced. Now, this is the table. From here we can see that the pyramidal tracts, which shows the origin, distribution and main action and the function of main action on the lower motor neuron, like whether it is excitatory or inhibitory, and the function of the tract. The pyramidal tract, it is, as I had told you, it is corticospinal and corticobulbar. Both of them, they are originating from the motor cortex. The corticospinal tract, it's a lateral one, it's a crossed one, and lateral corticospinal tract, whereas that other one, that is the anterior corticospinal tract, it is uncrossed. And it is also, we should not say it's an uncrossed one, but it is not passing through the pyramid. It is also crossing to the opposite side, but at the spinal level, whereas the lateral corticospinal tract, it is crossing over to the opposite side at the medullary level. They are the crossed one. These corticospinal tracts, they are excitatory to the hand and finger flexors. The flexor, they excite the flexors of the hands and fingers, and they are inhibitory to the extensors of the hand and fingers. And they control the fine voluntary movements. The corticobulbar movements, fine movements of the voluntary. The movements are voluntary, but they are the fine voluntary movements which are controlled primarily by the lateral corticospinal tract. The another one is corticobulbar tracts. The corticobulbar tracts, they origin from the motor cortex bilaterally, and they are excitatory to the cranial flexors to the lower motor neurons, and they are inhibitory to the cranial extensors to the lower motor neurons. Now, the extrapyramidal tract, that is the lateral one. The lateral extrapyramidal is the rubrospinal tract. Rubrospinal tract, as I had told you, it arises from the red nucleus of the midbrain, and it passes to it crossed over to the opposite side, and it is excitatory to the limb flexors. It is excitatory to the limb flexors, and it is inhibitory to the limb extensors. It controls the gross limb movements. Like it controls the rubrospinal tract, it controls the gross movements of the limb movements. That is, it is basically rubrospinal tract. It is supplying not to the finer muscles of the fingers. It is supplying to the muscles of the hand. And that is why it controls the gross movements of the hand, this rubrospinal tract. Whereas the lateral corticospinal tract, it controls the finer movements of the digits. Whereas this rubrospinal tract, it controls the movements of the gross movements of the hands. The other extrapyramidal tract, that is the medial group of extrapyramidal tract, that is reticulospinal tract. This, as I had told you, this reticulospinal tract, it's again classified as medial and the lateral reticulospinal tract. The medial reticulospinal tract, it arises from pons, and it is ipsilateral. The distribution is ipsilateral, and it is excitatory to the axial and proximal limb extensors. That is the axial muscles and the proximal limb extensors. Proximal, that is They are supplying to the core muscles of our body and the proximal limb muscles, that is to extensors, and they are inhibitory to the proximal limb flexors. The tract, that is medial reticulospinal tract, it is inhibitory to proximal limb flexor and it is excitatory to axial and proximal limb extensors. It controls, the function of this medial reticulospinal tract is to control postural control of the head and body. That is, it helps in postural, it works along with the anterior corticospinal tract and control the body and the head posture, postural control of the head and body. The lateral reticulospinal tract, it is bilateral, whereas the medial reticulospinal tract, it is ipsilateral, and reticulospinal tract, lateral reticulospinal tract, it is bilateral, and it is excitatory to the proximal limb flexors. That is, it is functioning opposite to that of medial reticulospinal tract. Medial reticulospinal tract, it is excitatory to the limb extensors, whereas the lateral reticulospinal tract, it is excitatory to the proximal limb flexors, and it is inhibitory to axial and proximal limb extensors. And this reticulospinal tract, the function of the lateral reticulospinal tract is body and head writing reflexes in response to abnormal posture. That is, it helps in postural adjustments. It is body and head writing reflexes. It is correcting the posture of the body. It helps in postural adjustments. Then another tract, that is the extrapyramidal medial group. Extrapyramidal medial group, that is vestibulospinal tract, and these are the two tracts, that is the lateral vestibulospinal tract and the medial vestibulospinal tract. The lateral vestibulospinal tracts, it arises from the lateral vestibular nucleus and it is distribution is ipsilateral. Distribution of the lateral vestibulospinal tract is ipsilateral and it is excitatory to axial and proximal limb extensors. That is, the lateral vestibulospinal tract, it is the function, it is excitatory just like the medial reticulospinal tract. The medial reticulospinal tract as well as the lateral vestibulospinal tract, both of them, they are excitatory to axial and proximal limb extensors. And it is inhibitory. It is inhibitory to the flexor group of muscles, just like the medial reticulospinal tract. So the lateral vestibulospinal tract, it works in conjunction with medial reticulospinal tract. And both of them, they are excitatory to the axial and the proximal limb extensors and they are inhibitory to the proximal limb flexors. And the function of these, they are also controlling the head and it is the vestibulospinal tract, they are controlling the head positions. They are controlling the body and the head position, as I had told you, during the angular acceleration and the linear acceleration. This lateral vestibulospinal tract, it is controlling the head position, balancing the head and the body during both angular as well as linear acceleration, because it is receiving the input from both semicircular canal as well as from the otolith organ. Whereas the medial vestibulospinal tract, which is originating from the medial and the inferior vestibulonuclei, they are bilateral in distribution and they are supplying the axial ipsilateral muscles. Axial ipsilatory muscles, and they are inhibitory to axial contralateral muscles. They are mainly concerned with the angular balancing of the body and head during the angular acceleration. They receive mainly inputs from three semicircular canals. The medial vestibulospinal tract, they receive input mainly from the three semicircular canals, and that is why they control the body and the head movements during angular. They balance the body and head during angular acceleration. The another tract of this extrapyramidal medial tract, it is tectospinal. Tectospinal, as you know, origin is from superior colliculus, and and immediately after arising from the superior colliculus, it is crossing over to the opposite side, and it is excitatory to the neck extensors, whereas it is inhibitory to the neck flexors. This tectospinal tract, it is sensitive to the visual stimuli, and it performs the postural reflexes in response to the visual, auditory and somatic clues. And predominantly it is sensitive. This tectospinal tract is sensitive to the visual stimuli, and it controls the contralateral movement of the head. And that is all about the tracts, motor tracts, or the descending pathways. Thank you very much.